Thank you for joining us again on another episode of the Commend Journey podcast. I am your host. My name is Michael Diamond, and I am happy to be joined by a guest. And I'm just going to, as always, let the guest introduce themselves. So please join us.
Hey, Mike. Thanks for having me. My name is Jen Borkowski. I am the Southeast Regional Sales Manager here at Commend, and I'm really excited to be chatting today about some awesome topics.
Fantastic. So one of the things that we were interested in talking about on the show, given the various industries that communication is critical in, one of them being the healthcare industry, and we wanted to have you come in and join us and talk about some of the things that have been happening in the healthcare industry, and then some of the things that the healthcare industry is looking forward to or you're seeing in the market. So I want to start sort of on the outside of that, and from there, where things have gone.
So I joined Commend quite a few years ago at this point. I actually started in the security industry right out of college and took a bit of a hiatus, but I was actually big in the healthcare space. I was a bio major, worked in healthcare for quite a bit of time. And then, as most of us, fell into the security world and really loved it. It was just a different approach to helping people, right? Different way of helping people. After I had spent some time in the video space, I came to Commend and really loved everything from an audio perspective. It was so unique, different challenges, different environments. And it always, I always thought about how that pertained to healthcare and how acoustically challenging a lot of these situations can be. And it really, really opened up my eyes to how important audio and communication is. I did take a bit of a hiatus and actually left and went into the medical industry after 3 years at Commend. So I worked in hospitals every single day and really worked with healthcare professionals on a daily basis, which also really helped me open up my eyes to the needs from not just a security perspective, but also from a healthcare perspective, right? And, that clinical side is something that I didn't really get exposed to when I was in the security industry. It was really mostly focused on security, but that clinical space is really interesting, and there's a completely different area and technology requirements that live on that side. So after a hiatus within the medical industry, I decided to come back to Commend because I love this company so much. And I've been here ever since for about 1.5 years, but just living in a bit of a sunnier place.
Fantastic. So the perspective there is pretty important, right? It gives you an opportunity to see that facet and that side of what's going on in the industry from being inside of it. And now being back outside in the security industry, you have an opportunity to apply all of that learned, lived experience. So I guess that rolls us into really the first big question, which is, what do you think the healthcare industry sees or acknowledges is its largest security focus or security concern?
So I think that that's a bit of a multifaceted question now that I am back and I see the security side as well as the clinical side, because although they have very similar challenges, they still have very different ways of utilizing technology. So I'd say in both instances, the biggest challenges that they're facing are 1, staff shortages, and 2, patient safety. And in my eyes, the answer to both of those challenges, the solution to both of those challenges is really technology.
I guess that's a great question. How does technology prove to be a barrier then?
From a security perspective, it's really important to have a unified security solution. That's what that was always my focus, back when I first started in the security space. How can I provide a solution, an audio solution that is integrated with video and access control, and where all the systems are working together to provide a safe environment for employees and patients? And that is definitely one big piece of it. We all know about the technology requirements on that side of it, because that's what we do on a daily basis, whether it's a healthcare facility, a corrections facility, you name it. that security perspective is very similar across the board. But what I found is different is that clinical side, because healthcare facilities are really looking at various ways they can leverage technology to essentially create and or improve operational efficiency. So what we've seen through COVID, right? And COVID actually forced the hand of a lot of healthcare facilities to come up with alternate solutions. Because when you don't have people to work because people are sick or there's just not enough employees, the show must go on in a healthcare facility. It doesn't stop, right? It's open 24 hours. So having technology that'll help automate things and really improve those operational efficiencies was really vital in that clinical side. During COVID, the PPE side of things, monitoring patients, right? A nurse would have to get gowned up, put on all of that PPE equipment. That would take a while to go in and speak to a patient. The amount of time that they were losing, most nurses had 3 patients that they were working with. The amount of time that they were taking to get gowned up, step into a patient room to just when the patient was just asking for water and getting that water, right? It was taking a significant amount of time. And then they had to degown, step out, get water, and then regown and step back in. So the amount of time that they were losing was significant. So providing a 2-way video intercom solution for those types of applications is something that became huge at that time, right? So how do you decrease the amount of time it takes to just perform routine tasks that in the past it was a nurse would just step into a patient room. They said, I need water, step out, get water. And it was something that was taking, 2 minutes of an interaction to 15, 20 minutes, right? And with so many patients and the influx of patients, it was definitely proving to cause significant amount of issues for them.
It's an environment too where, given the high COVID times, especially where there is no subverting regulations or those protections. So it's not like there's another option for them.
Absolutely.
And I think it's critical too when we talk about hospitals, we talk about staffing. It is something that even in pre-COVID times, it was clear that the industry was dealing with short staffing for a varied amount of reasons. You probably know that, given your experience in the industry yourself a little bit. It's clear that technology could potentially assist with that gap coverage, but it isn't going to be the end all be all. And I'm sure that the industry is looking for specific help for those problems, for those staffing problems. What solutions are they finding?
So I think solutions that they're looking for and finding are really ones that will make healthcare professionals' lives easier. That's anything from video to audio to AI. I think those 3 pieces really make up the clinical side of the technology space and are great ways to really solve a lot of the problems that they're facing, a lot of those technologies that they're looking for. Some of those problems include remote monitoring and observation, behavioral health observation, or projects that we've been working on like fall risk patients, right? Where patients are in bed, they don't know, they wake up, they're not sure where they are, and having the ability to really help them in a way where you're utilizing the video, you can identify that somebody's there, that the patient is getting up out of bed, the audio to tell them, hey, you're in the hospital, you should be in bed. But then couple that with AI technology where you're able to take that, predict that patient is getting up and that they may fall and address the situation before an incident actually occurs. Now that's saving a lot of hospitals money, time, resources, and really the migration has been very significant in that observation space. But also moving into buzzwords like telehealth, which is something that has been around for a bit of time, but really started getting bigger in this COVID era because there was just more demand and more need for remote health solutions where a human being doesn't have to be everywhere to help a patient, right? There's technology that could really automate a lot of these different solutions.
We could expand it out a little bit from from AI or telehealth specifically to look at public address and the way that hospitals really need to have a public address system too that is not only safe but relatively easy to communicate with the people who are on site, but also meets the compliancy standards that are required here in the United States and even beyond. So there's a lot of facets to communicating in our healthcare environments that are going to take a flexibility on a lot of different technological levels.
Yeah, I totally agree, Mike. The PA side of things has been critical. We're seeing a huge influx in PA solutions across the healthcare industry because, there's from just being able to communicate to everyone within the hospital. It's not just patients, it's visitors, staff, people coming into the facility, right? It's so important to be able to notify all of those different groups of people. Utilizing a unified platform where, you've got devices outside and parking garages and such, being able to communicate through those audio devices to tell people not to come in, telling everyone on a particular floor to shelter in place while another floor should be evacuating, another wing, being able to utilize all of their master stations, their intercoms throughout the facility, and their PA system all together is really something that a lot of hospitals are also moving to. They want a single platform that they could utilize, not just in one hospital, not one building, but across their campuses, across all of their facilities. The need for PA is certainly on the rise, and the ability to communicate and bring awareness to situations that are going on is definitely crucial in that type of environment.
If we look through we'll just say a crystal ball, and we looked at the next 5 years to 10 years, maybe in healthcare, how does the footprint change from what it is now? Where do they move to? And how can we get there?
So I think up until now, AI has really been something that was talked about, was a buzzword, but really the technology wasn't there. And I think we're finally getting to a point where it's readily available and it's ready for customers to utilize and solve their problems with. And I really think that over the next 5 to 10 years, AI coupled with, technologies that we have in place, such as, video, the eyes of a system, and audio, the ears and the mouth of a system, take AI and couple that with those two, it's super powerful. You're able to really take more on that you haven't been able to. And that's really going to expand the telehealth space where you can monitor, patients' vitals from a video camera remotely, not necessarily have to come into a patient room and check on them or, be at the hospital to check on those. Somebody could remotely be monitoring those critical stats and advising nurses and hospital staff of any inconsistencies, any issues. Even things like bed sores, that's something that we don't even think about. But, patients need to be turned every X amount of hours in order to actually to make sure that they don't develop bed sores or ulcers, right? That's something we don't think about. That's something really important. Patient limbs are outside of a bed frame, right? That's something we didn't really have in the past. That wasn't something that we looked at. It wasn't something readily available. But now, by combining really good quality technology with really awesome analytics, you're able to do so much more with that.
Absolutely. So I guess one of the next questions then, if we talk about the stuff that's coming, we're going to have to talk about integrating into the other systems that are in the healthcare space, right? So I wonder if you could speak to how important having systems that are going to be easy to not only interact with from a user space and even from the space of a client, but also interact with other systems that the healthcare facility might already have, fire systems, camera systems.
Yeah, so integration is super important. That's really because if it's done correctly, it both improves efficiency and can save our customers money if they're leveraging existing technology. And really in the technology space, it's rare to find a company that is good at everything and can do everything, right? There's not a company that is good at video and all the different aspects of audio and AI and, access control and you name it. But what I think is really powerful is bringing together partners who specialize in their respective technologies and providing a solution that solves that customer's problem. So, utilizing a PTZ camera that is capable of actually zooming in to see those vitals versus just a camera that is used for identification purposes is really important. We partnered with industry leaders to really deliver a secure and powerful solution. Within the solution, Hanwha provides a high quality PTZ camera for each patient room. Commend, we provide, crystal clear two-way audio via speakers and microphones. And then Nessa, our third partner, provides the video analytics. And that helps, address those risks before they happen. With these partnerships and integrations, we were able to really be just a part of a high quality solution. Where we're not trying to be everything. We're trying to be a part of that and be really good at that part of it. And that's really what I think the future of the technology space will be. And it's partners being more open to that and really coming together to solve those problems, because one company just can't solve every problem, right? We're not magicians.
It's a fantastic comment. And I think, honestly, a pretty perfect place to end. So thank you, Jennifer Borkowski, for stopping in and talking with us on the Commend Journey podcast. And I look forward to the next episode, as hopefully all our listeners do. Thank you.